Hello and welcome, everyone. Thank you for joining us right now. The show is being recorded as well. On behalf of ISC Entertainment Network, my name is Rohini Singh, and tonight we are very grateful and happy to have Jennifer Vibert, Senior Manager of Emergency Operations, International Operations, and Lead International COVID-19 Response for Canadian Red Cross. So we're really happy to have you on board. I just wanted to say also that the Indian Society of Calgary has partnered up with Canadian Red Cross, and we are working on a fundraiser. So thank you to everyone who has supported and to those who continue to support as well. So Jennifer, thank you so much for being here on the show with us.
Thank you so much for having me.
Thank you. Would you like to tell us a little bit about yourself and the role within the Canadian Red Cross?
Sure. So I've been an international aid worker for just over 10 years now. I've been with the Red Cross and Red Crescent movement for just over 5 years. And with the Canadian Red Cross as well as the International Red Cross. And I've lived and worked in a number of different countries around the world, including Kenya and Zambia and the Philippines, both on longer term development projects as well as the response to international emergencies.
That's very, very impressive and exciting. Wow, all those countries. Was there a special interest in working for COVID-19 for India?
Well, that's a good question. So when I was living in Kenya last year, I actually was working for the International Red Cross, and I was an operations manager who was responsible for actually the Pan-African COVID response. So I knew quite a bit about the pandemic as it was evolving. And then I decided, given that expertise, it was a good fit for me to take on the role of the coordinator, or what we call the event lead, for international COVID, and then for India as well.
Okay, great. That must have been a very it must have been an awesome experience for you, but of course we're dealing with a pandemic, so that must have been hard. How was it for you? Like just last year?
Yeah, it's been a busy year. I think it's been a busy year for everybody. I mean, because at the same time as you're sort of working on the emergency response, you're also being impacted by it yourself. So you're living and working only at home. You're doing a lot of Zoom coordination meetings and other online meetings, and then you're also in lockdown and with those restrictions as well. So it's been quite a busy year, but a very, very big learning experience for me.
Well, thank you, Jennifer. Okay, well, could you please share some of the relief work that you've done for COVID-19 in India?
Sure. So as everybody has probably heard, or everybody on this call has certainly heard, the second wave of COVID in India has been really devastating and has had a huge impact. It's over the past month, as we've seen the second wave crest, there's been hospital beds that have run out. There's been a shortage of oxygen supplies. There's been stock in pharmacies that has run out, and the impacts have been felt really around the country. We've heard such terrible and heartbreaking stories of whole families that have been impacted, with multiple people in the hospital at the same time, with people having to go out and search for oxygen and medicines for their loved ones. And it's really, really had a big impact on all of us at the Red Cross. The great thing about the Red Cross and Red Crescent movement, what we call the movement, we have a national society in every single country around the world. So when a disaster hits or when there's a pandemic, we as the Canadian Red Cross always work in partnership with the National Society, or the Red Cross or Red Crescent Society that is actually based in that country. So we're working with the Indian Red Cross, which has played a vital role in the COVID-19 response. It was declared an essential service provider from the very beginning of the outbreak, and it has continued to work tirelessly. Its staff and volunteers of over 46,000 have been working around the clock to respond to the huge needs. We have a very good relationship and a very strong partnership with the Indian Red Cross. And so this has allowed us to partner with them to provide things like monetary support. We are exploring possibilities of providing medical equipment and supplies. And we're also supporting with our staff, who are able to provide technical expertise and to work alongside our counterparts to ensure that the response runs smoothly and that it is responsive to the needs on the ground.
That sounds great. And were these part of the projects that were undertaken by the Indian Red Cross and the partnership between you and the Indian Red Cross?
Yeah, so I mean, the Indian Red Cross has a very diverse range of activities that it's
Hmm.
undertaking in response to the pandemic. So it depends really on because the Indian Red Cross has branches around the country in
Hmm.
every sort of cultural and linguistic context, and working with very diverse groups of people. They are able to do different activities depending on what the needs are in each of those particular areas. So some of the big pieces of support that they're providing have been running health facilities. So some of the hospitals and clinics that have been directly responding to COVID, or ones that have been taking some of the burden off the health facilities that have been responding to COVID. So taking some of the patients who are no longer able to be accommodated elsewhere.
Hmm.
They're also one of the biggest providers of blood services in India, so providing mobile blood banks, providing services for health facilities, and encouraging people to continue to donate blood despite the pandemic. They
Hmm.
run ambulance services in some areas, including in response to COVID-19. And really importantly, and this is something that the Red Cross movement has really been championing around the world, they talk to community members about what are they hearing about COVID.
Yeah.
What are they understanding? We all know that social media has had a huge impact on the response. There's a lot of
Yeah.
misinformation out there. So
Hmm.
talking to their own community members to try and understand what they're hearing, how they can help them to contain the spread of COVID-19, and how to dispel misinformation and to better protect themselves. This has been a very challenging response for a number of reasons, though. Also because there have been, I mean, just in the last 2 weeks, there's been two cyclones that have also hit India.
Yes.
And, natural disasters, unfortunately, just do not know or do not
Mhm.
care that there's a pandemic happening. So the response to those cyclones, at the same time preventing further spread of COVID-19 as people are evacuated, has also been something that the Indian Red Cross has been working on.
I'm really happy that you touched upon the challenges that the Indian Red Cross has been facing. Exactly what you said about the cyclones happening as well. Um, I mean, yeah, I, yeah. Do you think that Canadian Red Cross has made any, difference to the current COVID situation in India with everything that's happening and all these unexpected challenges that's coming up?
Yeah, with the pandemic of such unprecedented scale, I mean, really, it's the first global pandemic maybe in the whole history of the world.
Mm.
Um, I mean, there have been other pandemics that have hit, but every single country has been impacted in some way or other by COVID, whether it's cases, the socioeconomic fallout of the pandemic, people's mental health and psychosocial well-being. And in a
Mhm.
country as big as India, I mean, over 1.3 billion people, COVID has impacted everybody in one way or another. I mean, there were systems in place, absolutely, that the government of India had to respond to pandemics, just like in many countries around the world, but they were just overwhelmed by the sheer scale, especially of the second wave. So the kind of
Mhm.
support that we are providing and that the Indian Red Cross is providing, it may seem like a drop in the bucket. Any support may really seem like a drop
Mhm.
in the bucket when you think about the scale of the pandemic. But I
Yeah.
can tell you that it means the world to the people who are reached. I mean, we've had 770,000 people that the Indian Red Cross has reached with psychosocial support. It's been so difficult for people to cope as their family is impacted, as maybe they're losing loved ones and friends. And they have provided also 31 million cooked meals and dry rations to migrants and to the host communities that are hosting those migrants in India. And I think that you can't discount, even though the pandemic is so big, you really can't discount the impact on every individual who is a recipient of some of that assistance provided by Indian Red Cross.
Mhm. Thank you. Thank you for sharing that. Jennifer, we're going to just take a short break. We'll be right back and we are going to talk more about, how we can help and what we can do to help.
Do you know the area of your house decides the school your child will go to? Do you know how to check the quality of a home? Will banks give you a mortgage? For all the answers, sign up with the Home Buyer Awareness Program and meet a school area specialist, a home quality inspector, and a financial advisor. Don't wait. Sign up with the Home Buyer Awareness Program in the link below or contact Raj Bopla at Remax Central today.
Thanks, Jennifer. So you talked a lot about how the Indian Red Cross is working tirelessly to, tirelessly around this pandemic. What would you say, how is Canada and other governments helping the pandemic in India right now?
Yeah, it's always so wonderful to see the generosity of Canadians and the Canadian government anytime that there is a crisis somewhere around the world. And this has certainly been no exception. And with the support of the Canadian government, there has been able to be supplies shipped to support the government of India. I also think that there are some provincial governments that have provided supplies and equipment that were flown to India as well. And in addition, the federal government of Canada, as well as some provincial governments, have provided support to the Canadian Red Cross to allow us to help the Indian Red Cross and channel that support to the Indian Red Cross. So there's been donations to our public appeal that have been received. And in addition, funds that the federal government has channeled through us to support the International Red Cross in its support to Indian Red Cross as well. So it's been really wonderful, and we're really grateful for the support of those governments to enable us to better respond.
And that's just a lot of unity and people coming together. So that's great. I did mention earlier, but the Indian Society of Calgary has partnered up with Canadian Red Cross, and there's a fundraiser. So everybody who's watching, if you want to support, please, click on the link and you can. Jennifer, what would you like to urge the Indian diaspora in Canada and other Canadians as well, to contribute to this fundraiser and in general for crises that people do want to help?
Sure. I mean, I would always very much encourage people who have not donated to contribute to your fundraiser, or they can always also contribute at redcross.ca to the India COVID response. And I guess I would like to thank people for keeping this in their minds and for taking the time to stay aware of what's happening, and just to urge people that as the pandemic maybe winds down on a more global scale, there will still be other waves that will be happening in different countries at different times. I mean, unfortunately, the possibility of a third wave impacting India and South Asia later this year is something that we do have to prepare for. Hopefully, it won't be nearly the severity that the second wave has been, but we certainly have to keep the preparedness and readiness to respond to another wave on the forefront of our minds. And so any support that is provided to the Canadian Red Cross will be channeled also to the Indian Red Cross, and with our support to them, we'll continue to work alongside them to prepare for any additional waves. But not just that, as the numbers continue to drop, we often forget about the fact that these socioeconomic impacts will continue to be enormous and will be felt for years and years and years. So I guess I would just like to urge people to keep in mind that when things drop out of the headlines, that doesn't mean that the needs stop. And we still require support to enable a recovery and preparedness for any future activity or any future pandemic waves.
So, you talked a lot about preparedness as well. And would you be able to share some of the future plans that, that these funds can be utilized for, and just in general, what's the plan?
So when we work with the Indian Red Cross, I mean, they're the ones best placed to know what the needs are on the ground. And of course, even with the second wave, while we've seen some of the numbers drop in urban areas quite dramatically, what we're afraid is happening now is that the waves are moving out into rural areas. And rural areas are often ones that have less testing capacity. There's less ability to measure and to properly count or accurately count the number of people who are impacted. And so we want to continue to provide that support so a lot of future activities will involve making sure or trying to strengthen the ability of governments and the communities out in rural areas to respond to the rise in case numbers out there. Uh-huh. We will also continue to support with some of the socioeconomic aspects of recovery. So providing support for people to get back on their feet, people who have exhausted their coping mechanisms and now require a bit of support to get their livelihoods back. And we'll just rely on what Indian Red Cross sort of tells us are the greatest needs, and continue to be there to provide support in different ways and different modalities as the needs are changing.
Thank you for that. And you mentioned that different support in different ways. Like, what if people are unable to give monetary support? How can they, support the Red Cross? Canada, India, wherever.
Yeah, if people are not able to donate, I mean, certainly we are always appreciative of, following us on social media channels, using their own voices to raise awareness to other people around them of what's going on. Keeping the pandemic and its diversified impacts in people's minds, even as the situation in Canada hopefully improves in the coming months, just keeping the awareness raised and keeping their friends and family informed about what's going on, and continuing to raise awareness of the response efforts as they keep going.
Okay. Great. Thank you, Jennifer. Is there any other message that you would like our viewers watching to take away? And I mean, I know it was great, definitely keep this in mind, help out, support. It's anything else you would like to say?
Just wanted to say, thanks so much for the solidarity, for people's generosity, for their contributions, and for, continuing to keep the situation in their minds and make, the effort to listen tonight and to keep the awareness rate going. And thank you very much to, governments as well as the people listening today, and everybody who's donated for your support. And just to urge that, that support continues to be needed. So any little bit helps.
Thank you so much, Jennifer. Thank you so much for being here with us. And we all sincerely hope that we can get this pandemic under control, and we can all help each other by the ways we know how and by our own capacity. So thank you so much.
Thank you very much for having me. It's been a pleasure speaking to you.